And this morning, some new ways to think about diet and exercise.
Yeah, in recent years, the national focus on health has skyrocketed. So the question is it actually making a difference? Everywhere you look, promises of a new healthy start.
I never felt like this.
Those ads, apps, and devices trying to get you to exercise. Well, they are working. According to fitness industry data compiled by Axios, gym memberships were up 21% from 2007 to 2017. But surprisingly, so were obesity rates, up 17% over the same 10-year period. The problem? Experts say the food we eat.
There's not a lot of places to get healthy foods.
According to the CDC, only 1 in every 10 adults eat the right amount of fruit and vegetables each day, and more than a third of Americans eat fast food daily.
I eat fast food like 3 times a day.
A lot of people aren't cooking at home. They don't have time to really be at home.
There is some good news, though. Data from the CDC shows a decrease in the number of adults with high cholesterol and a drop-off in the rate of new cases of diabetes. But experts say that may be due to increased medical treatment, not necessarily better eating habits. Just last month, Weight Watchers adopted a new name, WW, Wellness That Works, a change that represents a shift away from the diet culture and toward a more holistic approach to health.
There's a place where the best...
And they're not the only ones.
Whoever said working out can't be fun?
With so many mixed messages bombarding us daily, experts say it's no surprise Americans are confused and have diet fatigue. They also say many of us are just plain tired. Lack of sleep and stress have been shown to contribute to weight gain, too. So while a record number of us are hitting the gym, wellness experts say losing weight and achieving overall health will not work out unless you watch what you eat. Okay, with all that in mind, why don't we bring in NBC News medical contributor Dr. Natalie Azar. So when you look at the headline, you're like, oh my gosh, I've been sweating in the gym and it's all for naught. I mean, I'm not dropping any weight. So what's the takeaway?
Well, here's the thing. I think if you think that your end point is going to be weight loss, exercise is probably not going to be the key determinant.
Right.
And there's a couple reasons why. We know that if you exercise a lot, it can increase your appetite.
Yeah.
We know initially it can really burn calories more quickly, but then that can kind of plateau. But the important messaging here is that exercise is still obviously important, but it might just not be the key thing when it comes to weight loss as your endpoint.
So what are the hidden things that are causing weight gain? I mean, obviously, if you eat too much or drink too much, guilty. But like other than that, I mean, there's some other things that might be causing it.
Absolutely. One of the biggest reasons that people can gain weight is actually stress. If you think about it, right? I mean, stress releases a hormone called cortisol, and it's not the same in everybody, but for a lot of people, that cortisol can increase your appetite. You can gain weight that way. Another reason why is sleep. We talk about sleep a lot. Again, a hormone issue. If you're not sleeping enough, it causes a shift in those hormones that cause increased appetite versus satiety and also medications. So you can think of it as the 3 S's. Side effects of certain medications can also result in weight gain.
The diseases associated with obesity, in that story there, it shows, diabetes going down, high cholesterol, hypertension, all of these things are on the decline, but weight gain's increasing. How can that be?
How do we explain that? We explain that basically by saying that these conditions are being medically treated. So you would think that there would be a commensurate rise in those conditions with obesity, but in fact, that's not true. But let me be the first, and not the first person to say this, but ask any of my patients, there's almost never a reason that I tell people not to exercise. And we can't ignore the positive impact that exercise has on cardiovascular health. It can decrease certain cancers and diabetes. It improves mood and sleep. If you're talking about weight loss, exercise in addition to dietary changes. So it's more important what you put into your body than actually what you're doing with your body.
Is there a better time to exercise that helps you with weight loss?
That is an excellent and unanticipated question.
What is the answer?
You know what? I'm not going to answer this in terms of a physiological answer or a scientific answer. A lot of people will say that earlier in the morning is the better time to do it. You have more energy at that time of day, and it's definitely not good for sleep hygiene to exercise right before bedtime. So I'm going to go on record and say earlier in the day.
All right. Dr. Azar, thank you so much.